In a world where I was trained to have answers, my own health became the question mark I couldn't escape. My days were filled with patient charts and diagnoses. Yet, the most perplexing case was the one I couldn't chart, my own. When I graduated from medical school, I was certain I had become a healer and doctor. I became a family physician for the next 10 years and knew I was doing a good job. On the outside, I was successful professionally. I graduated at the top 2% of my class in medical school at UCLA. I loved my family medicine residency. I was married with my first child on the way when I started my first job with Kaiser Permanente nearly 25 years ago. Yet, there were frays. By all accounts, I was a well-loved and high-performing family practitioner. I loved my job as a medical director of a large clinic, teaching and managing other doctors and staff. I loved being a doctor. However, my own health puzzle and frustrations were spilling into my work and care of patients. I could no longer separate my physical and mental health struggles from my professional self. The birth of my first child led to a series of health mysteries no one could solve. I had severe postpartum depression, mastitis, infection in the breast, and an antibiotic-related infection called C. difficile. I was feeling worse every day throughout my body, yet all of my blood work was normal. None of the rounds of treatment helped me. These health symptoms culminated into yet new symptoms when my second child was born. I developed insulin-dependent diabetes during my second pregnancy and ongoing chronic fatigue, weight gain, and hair loss issues. At the age of 36, I went into full-blown early menopause, and yet no one knew why. I had severe fibromyalgia, which most doctors then and now don't believe is real, and chronic pain in my elbows, jaw, and back. I had neuropathy and nerve-related pain in my low back going down my left hip and leg. I was gaining weight and losing hair, and I couldn't sleep. For nearly a decade, I slept less than 3 hours a night. I attributed it to stress from a huge patient load, clinical management responsibilities, and a failing marriage. I felt alone. I was disconnected from my body, soul, and the world around me. The loneliest times were in the middle of the night when I couldn't sleep. When my then husband came to bed, I would pretend to be asleep. Yet, I would lay awake all night, feeling alone, scared, and shut down. I thought, isn't this how everyone feels in their 30s? To add insult to injury, mysterious symptoms kept emerging. Why was I losing my edge, focus, and mind? Why do I feel like I have attention deficit disorder, ADD? How did I get diagnosed with it in my late 30s? Now, not only am I on antidepressants, but also ADD medications and a slew of other medications I prescribe to my patients all the time. I prided myself on remembering fine details about my patients, yet I struggled with numbers and dates. I was feeling sick, physically and emotionally. I knew I wasn't well, but I thought I was expected to be feeling great. Another driving force was that I didn't want to be a failure. I've never been someone who failed in whatever my goals were. I did not want to be a failure to my parents, family, or my patients. The disparity between what was on the outside and what was happening inside created feelings of guilt and shame. I judged myself by thinking, you shouldn't feel this way. Deny, reject, delay. I got physically so sick that it impacted me professionally. I lost myself, my job, and my marriage. I hit rock bottom. There's something about the bottom and those moments of darkness that laid the foundation for how I started to get better. I could have died. I got close. I could have given up. I didn't. Something in me knew that this wasn't it. There must be something I'm missing that I'm not seeing. What was I not seeing?